Hello, my name is Casey Kegelmeyer, and today I will be presenting my research findings for Assessment 4 of Capella University's NURS-FPX4030, Making Evidence-Based Decisions. In this video presentation, I will discuss the evidence-based care plan that I have created for a patient with chronic obstructive pulmonary disease, or COPD. Using an evidence-based practice model, I will discuss how evidence-based research will improve the effectiveness of the interdisciplinary team's patient care as they collaborate remotely. I will discuss why I selected the specific EBP model I used, as well as list the benefits and what changes may be implemented to improve the patient's care when using remote collaboration. I will cite all sources of evidence-based research used within this video presentation using current APA formatting. In this case study, our patient is a 70-year-old male who has been diagnosed with COPD. He frequently experiences respiratory infections, shortness of breath, and a chronic cough. The patient lives in a rural area and pulmonology services are far from his location, creating the issue of in-person access to specialized lung care. The care team, consisting of a primary care nurse, a pulmonologist, respiratory therapist, and a pharmacist, are meeting remotely to discuss the plan of care for the patient. Sarah, the patient's primary care nurse, begins the meeting by suggesting the creation of a comprehensive treatment plan for the patient with the rest of the interdisciplinary team. The pulmonologist, who has reviewed the patient's health record, suggests medications such as bronchodilators, corticosteroids, and a long-acting inhaled medication. The respiratory therapist informs the rest of the team that they have been meeting remotely with the patient and teaching the patient breathing techniques and breathing exercises to increase lung capacity and improve the patient's overall breathing. The respiratory therapist explains that the patient is seeing improvements from these virtual therapy sessions. We then hear from the pharmacist, who has valid concerns with the patient's understanding of potential medication interactions and side effects. The pharmacist suggests providing the patient and his family with educational materials and virtual counseling sessions to ensure proper use of meds. The virtual meeting concludes with Sarah, the primary care nurse. She suggests follow-up remote meetings with the team to track progression of the patient's COPD and to monitor medications and success of the treatment plan they have created. In my opinion, the interdisciplinary team was efficient in their meeting at honing in on the most important areas of their care plan. I think their meeting was effective and everyone left with a mutual understanding of the care plan. I do think the patient's primary care physician should have been involved in the care team remote meeting. The primary care physician will be with the patient in person, and that may give them a better idea of exactly how the patient with COPD is responding to the treatment plan based on them being able to visualize the patient in person. The primary physician is going to be providing the majority of the patient's healthcare and should be a large part of the interdisciplinary team. The care team should also have spoken more in depth regarding the current lab results for the patient's pulmonary function. While the success of the care team's interventions can be determined subjectively by how the patient says they feel, objective data such as lab results give the team recordable data to track the patient's disease progression. Upon researching evidence-based practice models, I have selected to use the Johns Hopkins Nursing Evidence-Based Practice Model as a guide to determine useful recommendations to add to the existing care plan of the interdisciplinary team. The Johns Hopkins Nursing Evidence-Based Practice Model, according to Newhouse and colleagues, and I quote, "Evidence-based practice EBP positions nurses to be significant influence on healthcare decisions and a partner in improving quality of care," end quote. A journal article from Brunt and Morris explains that the Johns Hopkins Nursing Evidence-Based Practice Model is a process consisting of 3 steps. This evidence-based practice model uses the acronym PET. P standing for practice question, E for evidence, T for translation. Implementation of evidence-based material in nursing practice has proven to lead to improved patient outcomes and improvement in patient care. Dang and colleagues explained the steps of the Johns Hopkins Nursing Evidence-Based Practice Model in more detail. The practice question step consists of identifying the problem and assembling the interdisciplinary team. Step 2, evidence, consists of locating and researching evidence-based material as well as determining the credibility of the material and recommending changes based on the material that is found. The final step, translation, consists of the creation of the care plan, the implementation of the care plan, evaluation of the outcome, and publishing the findings either internally among the team or externally. One issue with COPD that was touched upon by the respiratory therapist is the patient's diminished lung capacity. I have found research that suggests that the simple act of walking is beneficial to elderly patients with COPD in improving lung capacity and function, thus improving overall patient well-being. With the use of PubMed, I found a study conducted by Novatoa and colleagues in 2022. The study was conducted to prove the incorporation of walking into the daily exercise regimen of individuals over 60 years of age improved lung capacity. The lung capacity of the studied individuals was measured using incentive spirometry. Participants were males and females between the ages of 60 and 88 years old. Multiple different modes of walking were introduced to the subjects, including fast-paced walking, standard-paced long walks, as well as walking on treadmills. This patient with COPD would benefit from a standard pace walking, beginning with short distance intervals to gradually work up to longer walks as tolerated. The patient will be monitored during this exercise by the use of a pulse oximeter and also use of an incentive spirometer to show improvements in lung function. The study by Novatoa and colleagues determined a significant improvement in forced expiratory volume among those subjects who implemented long walks into their exercise regimen. For patients with COPD, the issue is being unable to adequately blow off excess CO2. Our patient may benefit from incorporating walks into his daily schedule. Doing so may help his lung function to improve and allow him to blow off more CO2. This intervention can be done easily with a family member assisting the patient to ensure safety and prevention of potential falls. Incorporating walking into the care plan will hopefully cause an increase in the patient's overall lung function, improve laboratory results, possibly decrease polypharmacy risks, and improve overall patient well-being. By using the Johns Hopkins Nursing Evidence-Based Practice Model to form a possible intervention for this patient, we will be able to identify the issue, create a plan, implement the plan, determine if a possible outcome exists, and report the findings among the interdisciplinary team. Incorporating walking into the patient's daily routine is a safe, proven effective method to improve lung function. This intervention is non-invasive, it's easily implemented, and safe for the patient when compared to other interventions, such as incorporating more potentially dangerous medications. The remote collaboration between the interdisciplinary team is effective and can be maintained throughout the course of treatment. The use of electronic medical records allows members of the interdisciplinary team to view and monitor all patient health data in one location. The use of FaceTime and Skype conference calls, as well as video calls, make interdisciplinary team meetings accessible to all members of the healthcare team, including the patient and the patient's family. With the implementation of a walking regimen and introduction of the patient's primary care physician, the team will be successful in managing their patient's condition effectively. This concludes my video presentation for NURS-FPX4030 Making Evidence-Based Decisions Assessment 4. Thank you.